had an opportunity today to discuss a little bit about our new ABCD keratoconus classification, staging, and also the ABCD progression display that was recently available on the pen account. And the first thing I want to say is it's available to all the software users. I don't believe there's an upcharge. They just need to really contact Oculus to get the new software. The Amsler-Krumak classification has been the bane of my existence. It's a useless classification that for some reason ophthalmology continues to utilize even to this day, even though it's 70 years old and based on outdated information. So the ABCD is an attempt to have a new staging and classification that looks at each anatomical layer. The A stands for the anterior surface, and what we measure is the anterior 3 mm zone surrounding the thinnest point of the cornea. B stands for the back, or the posterior radius of curvature taken from the 3 mm zone, centered on the thinnest point. C is for corneal thickness, and it's the thinnest corneal point on the cornea. And D is distance visual acuity, or best corrected distance visual acuity. So we have 4 different stages plus a stage 0. Stage 0 represents a normal eye, and the machine automatically will determine this to you. So each anatomical layer is individually classified. This is important because in the past, when Amsler-Krumak came out, we really only had 2 options, contact lenses and penetrating keratoplasty. So it really wasn't important whether you had early disease, subclinical disease. All that mattered was, did you get so bad that you needed a transplant? But now we have many different options that really require that we grade each anatomical layer separately. That was really the first step of what we were trying to do, but the ultimate goal was to have a progression display. And that is to know when and if statistically significant change actually occurs. And to do that, we had to determine the noise levels of each of these new parameters. So we had a rather large population base, and we determined what's called the one-sided confidence interval. That is, when do we outside the normal measurement noise level of each of these parameters? And we now have a progression display that allows us to display up to 8 exams over time. We show both an 80 and 95% confidence interval in both a normal population and a keratoconic population, and you can determine when you have statistically significant change. The reason we use both an 80 and 95 in a normal and a keratoconic population is that we know as the cornea gets more irregular, like in keratoconus, the normal noise measurements become greater. But if you have an early or a very young patient or a patient with subclinical disease, you probably want to compare that more to the normal noise level, not the keratoconic noise level. If you have an older, more established keratoconic population, that person probably mimics the more keratoconic database closer. We also give you an 80 and 95% confidence interval so you can determine your risk assessment for that patient. So again, you can display up to 8 different exams over time. You can display, depending on the patient's age, the patient's degree of keratoconus, whether to compare that against a normal or a keratoconic population, and you're able to discuss some risk assessment with the patient. But this is the first time we really have the ability to document true ectatic change even before the patient becomes symptomatic. Thank you.
Thank you.